Dr. David Stoker, board-certified plastic surgeon in Los Angeles, looking at a 9-month post-op result on upper blepharoplasty. You can see here, if we close her eyes, go ahead and close, a very nice incision here, beautifully concealed. You see just a tiny, tiny ridge. It's right where the natural crease is on the eyelids. Go ahead and open. We really opened up her eyes. She has a fairly low brow position here, and that is significant. It varies between individuals, but because the brow position is lower, it's really important not to have any excess skin covering up her eyes. Her eyes are particularly nice looking, but if you don't have enough light getting in there because it's obstructed because of overhanging upper eyelids, they lose a lot of the sparkle. And here you can see she's got a tremendous amount of sparkle in those eyes with this nice lighting. There's another thing that we did too, which is fractional carbon dioxide laser resurfacing. That's a mouthful, but it's super effective at erasing fine lines and wrinkles. In particular, in these lower eyelids around in this area here, I'll show you what the before and after pictures look like on that, but it basically eliminates the outer layer of epidermis and dermis, and when the body heals, it deposits a fine layer of collagen. I think it's kind of comparable to resealing your driveway, where it fills in all the cracks and tightens things up. It's highly complementary to the upper eyelid surgery. And I think the two work together here and really rejuvenate her eyelids and restore the beauty that we were trying to achieve. So I'm super happy for her 9 months out upper eyelid surgery and carbon dioxide fractional laser resurfacing of the full face, including the eyelids.